Hi guys, today we will talk about erythropoiesis. What is erythropoiesis? Erythropoiesis is nothing but origin, maturation, development of RBC. So, origin, development and erythrocytes is called as erythropoiesis. And where RBC are produced? RBC are produced, usually you know that it is bone marrow. Other than that, prior in the womb and in the early ages, where it is produced? Fetal life, the first trimester, we call that as mesoplastic stage because the RBC are produced from the mesenchyme of yolk sac. And in the second trimester, it is called as hepatic stage because liver is the predominant one producing the RBC. Other than liver, spleen and lymphoid organs are also producing RBC. And coming to the myeloid stage, that is nothing but the bone marrow that starts from the third trimester. And up to the age of 20 years, bone marrow of long bones as well as flat bones will produce RBC. After 20 years, it is only flat bones like sternum, skull and the iliac crest will produce the RBC. And the bone marrow, 75% of the bone marrow is the cellular component, 75% is occupied by leukocytes and 25% is erythrocytes, as leukocytes are having very short lifetime, they are more in number. And coming to the stages of erythropoiesis, the stages of erythropoiesis, we have one is the stem cell and it is blast forming unit erythrocyte mentioned here, and chrononormoblast, early normoblast, intermediate normoblast, late normoblast, reticulocyte and erythrocyte. See here what is happening to the size. The size is decreasing. So in the process of erythropoiesis, size is decreased from 20 microns to 7 microns, that is RBC. And can you see the nucleus present here? Present and is absent and is absent. So disappearance of the nucleus occur. And if you see the color of the cytoplasm, here it is basophilic and here it is both, and here it is almost acidophilic. So staining of cytoplasm is also altering due to the presence of hemoglobin and absence of, and the process from blaster forming erythrocyte to erythrocyte takes around 7 days. So the first stem cell, which is homocytoblast, is large and is deeply basophilic, and if you see here, hemoglobin is absent. So still it basophil, and the capability of division is almost similar. Mitosis present in all the three stages: homocytoblast, chrononormoblast, early normoblast. And here the nucleus is having 4 to 5 nucleoli, and that is decreased to 2 to 3 nucleoli, and the nucleoli disappears in the early normoblast. And if you see the size, it is 19 to 23 microns here, 15 to 20, 12 to 16. So the size is decreasing. Now coming to the next stages, intermediate normoblast, the hemoglobin first appears here. So staining will be acidophilic plus basophilic. So we call that as polychromatic normoblast, and nucleus becomes condensed, coarse, and it becomes very condensed, and here the size is around 10 to 14 microns. Still mitosis is present but not that much. And coming to the late normoblast is called as orthochromatic normoblast because the cytoplasm is now acidophilic because the nucleoli disappeared and nucleus becomes very condensed and becomes like an ink spot. We call that as peak note, and hemoglobin is increasing. Now the mitosis is absent. So HB first appears in the intermediate normoblast and mitosis is first absent in the late normoblast. And coming to the reticulocyte, still it is acidophilic and the mitosis is absent. Hemoglobin is still appearing, it increases in amount. Nucleus is already gone. and it reaches to 7 to 7.5 microns, and it is stained by supravital staining by crescent blue. So the remnants of RNA appears like a reticulum. That's why it is called as reticulocyte. Now it comes out of the bone marrow into the bloodstream and goes to the spleen and matures there to form the mature erythrocyte. So this is the reticulocyte with nucleus extruded out, and it is squeezing out through the spaces of the endothelial capillaries and entering into the bloodstream, and then it matures after 24 hours to a mature erythrocyte. So 1 to 2 days in blood. So you can see here the supravital staining by crescent blue. The reticulum is appearing dark blue in color, that is called as reticulocyte. And if you see the size, it's almost 8 microns, whereas an RBC is around 7.5 microns. Matures in spleen, and normal count of the reticulocyte is adults will be having 0.5 to 2% of erythrocytes as reticulocytes, and in children it is 2 to 6%, and in adults if it is more than 2% we call that as reticulocytosis, and usually it is seen in hemolytic anemias and in the treatment of anemia. If you are treating a person with iron supplementation, we can know the response to the treatment by knowing the reticulocyte count. So summarization of all these stages: pro-erythroblast, here synthesis of hemoglobin starts, but it is not appearing. Starts, but it's not appearing. Early normoblast, nucleoli disappears. Intermediate normoblast, appearing, hemoglobin starts appearing. Late normoblast, nucleus is disappearing. Reticulocyte, reticulum is present, and the cell enters the capillary here. And the mature RBC, reticulum disappears, and cell now reaches the shape of biconcave. And what are the factors that are necessary for erythropoiesis? The factors that are necessary are general factors, special maturation factors, and factors necessary for hemoglobinization. So what are the general factors? General factors are nothing but the general metabolic hormones, like one is erythropoietin. Erythropoietin is required for the production of RBC, and erythropoietin is produced from kidney. So it is a glycoprotein hormone and is produced by the peritubular capillaries. Stimulant for this production is hypoxia. Whenever the blood flow to the kidney is lowered or oxygen carrying to the kidney is lowered, the peritubular capillary cells gets excited and they will produce erythropoietin. So hypoxia, either decreased oxygen or due to decreased RBC count, causes increased erythropoietin secretion. This stimulates the erythropoiesis in bone marrow, so that causes increased production of RBC. And now again blood oxygen level returns to the normal and erythropoietin secretion is decreased. And coming to the actions of erythropoietin, erythropoietin will almost affect all the steps: differentiation of stem cells, promotes hemoglobin synthesis, and it stimulates every stage of maturation. Even it promotes release. And what are the factors that increasing the erythropoietin? These are the general factors like androgens, metabolic hormone like thyroxine and growth hormone, hemolysates. So the products of RBC destruction will further stimulate the secretion of erythropoietin, and the nucleotides like cyclic AMP, NAD and NADP also increase erythropoietin secretion, and the vasoconstrictor drugs which causes decreased renal blood flow, so decreased oxygen to the kidney, that stimulates the erythropoietin secretion. And factors decreasing erythropoietin secretion are adenosine antagonists like theophylline and the female hormone, the estrogen. These are the inhibitors of erythropoietin. And special maturation factors, they are vitamin B12, intrinsic factor of Castle, and folic acid. So vitamin B12, which is taken in the diet, is absorbed in the ileum only in the presence of intrinsic factor. Intrinsic factor is the one which is secreted from the parietal cells, will bind to the B12 will bind to the B12 and that will cause the carrying of this B12 to the ileum without any destruction in the stomach, and now in the B12 in the ileum it is absorbed. So the intrinsic factor is required for the absorption of B12. So B12 is called as extrinsic factor and it helps in the synthesis of DNA. DNA synthesis should occur for the mitosis to occur, and this causes maturation of nucleus and cell, nothing but division, and daily requirement is around 1 to 2 micrograms. So deficiency of B12 leads to failure of maturation of nucleus, so no division, so cells remain large, they are called as like megaloblasts, nothing but the proerythroblasts, and they are more fragile, causes lysis and anemia. So if you can see, these are the megaloblasts, and even WBC are suffering from division. So cell division. Folic acid requirement is around 100 micrograms, and this is also essential for DNA synthesis for the formation of nucleotides. So if you see here, the tetrahydrofolate, to be converted into tetrahydrofolate from methyl tetrahydrofolate, we require B12 for the conversion of homocysteine to methionine, which is a cofactor or is like an enzyme. So tetrahydrofolate is formed. Now this tetrahydrofolate is required for the synthesis of nucleotides. So B12 is required for the formation of tetrahydrofolate and tetrahydrofolate is required for the formation of nucleotides, and this causes the division of the cell. And the factors necessary for hemoglobinization or proteins. So we know that hemoglobin contains iron and globin. Heme and globin. Heme is nothing but iron containing pigment. So iron is required, globin is nothing but a protein, so we require high quality amino acids and also iron, and there are some substances which help in the absorption of iron as well as hemoglobinization like copper, cobalt, calcium, vitamin C and bile salt. So these are required for the hemoglobinization. The prime components are proteins and iron. This ends the erythropoiesis. Thank you for your patience. Bye.